A community health worker is someone who serves the patient not as a social worker or a patient advocate, but like somebody in between there. We help them get connected to resources in the community that they either couldn't find on their own or, that no one else referred them to. The gap in our community is when our patients have to get to doctor's appointments, or they have to get to school, or they have to find Medicaid, or they have to have Medicare. No one really cares on why they don't have it. No one cares on why they're not making it to their doctor's appointments. So I think the important part of the community health worker is to make sure that the things that no one else is looking at in our community for our people, that we provide it for them and we help them get access to it.
We're helping people to navigate through governmental programs, the governmental assistance programs like food stamps and things like that. The reason why our team is able to assist with these things is because we've done it for ourselves in our own personal lives. We create an individualized care plan for each of our participants in our program, each of our patients, and that plan is made up of the physician's goals for themselves, their own goals for themselves, the community health workers' goals for them, and it's measured and tracked and celebrated along the way with success. There are so many barriers that exist in the underserved areas of Louisville, Kentucky. We want people to focus on their health and so they can live longer, for their children, for their families, for themselves. But we know that in underserved areas, people can't focus on their health. You can't focus on your health whether you're in an underserved area or not. You can't focus on your health if you're not sure where your next meal is coming from, if you're not sure where your children are going to lay their heads tonight. You cannot focus on your health.
I think I wanted to be a community health worker for sure. When I got my first patient, she was going through a lot. She had a baby. She didn't have any resources to help her with her baby. She was having some troubles at home, and seeing the results from her made me want to continue to help other people. To see my patient progress has been amazing. She started off with literally nothing, and now she has access to her doctor's appointments. She has access to food. She has access to baby items. We've gotten her playpens and wipes and baby clothes and provided her with information to get into school, to get her own car, to get her own, her own everything. So from having nothing to going to have everything for her, that's been an amazing transition.
Our community health workers are embedded in the community. They are seated within low-income public housing locations, and they are also within Norton Healthcare primary care practices and pediatric offices. We are receiving active referrals from all of those sites, and then you can also self-refer yourself to our community health worker program. They are that trusted link to the patient that will drive patient accountability and drive patient trust between the healthcare system through a trusted relationship with their community health worker.
It doesn't stress me out to come to work, and I feel like that's important to have in a workplace. The more that you wake up and hate your job, the more you're not going to want to go to it. And I have not had that feeling once since I've been in this institute.
This work is my bestest thing. And bestest may not be a word, but this is my bestest thing. This work is to be able to have an opportunity to have an organization to call me in and to let me be able to do the work that is so close to my heart and so close to my own life. I am the people we serve. My team are the people we serve. I'm just so very grateful. I'm just so very grateful. I feel blessed, I feel honored, and I feel a lot of responsibility to make sure that we can't change the world, but I believe that this program can definitely move the needle a little bit toward positivity, because we're doing things differently than they've ever been done. And my best saying is, if you want something different, you have to be willing to do something different.